Hi, everyone, and welcome to this interview with Master Chiropractor Adjuster Extraordinaire, I'd like to call him, Dr. Roger Turner. This is part of the Adjusting Attitudes blog. I'm going to do my darn best to give you a inspiring, motivational interview every month. And this month, I thought this was a pretty special interview. I had the opportunity to go to Toronto, Ontario in Canada to do a seminar that I've been waiting for a long time to do. I know as chiropractors we're always taught to go from C1 to the sacrum, and definitely wanted to expand my knowledge and bring on the whole concept of doing cranial adjusting. And I know there was a lot of options out there, and I had been recommended very highly to go to this seminar put on by what we call the CATS workshop, which is given by this gentleman right here, Dr. Roger Turner. So Roger, welcome, and thank you very much for accepting to do this interview with me.
Well, thank you for asking.
So maybe we can start off, Roger. I have to say I was totally inspired by this past weekend and what you taught us and how important the cranial bones were. Maybe you can start off by just telling my group of people and the people that are going to be listening to this interview who you are and where you've been, what you've done, and give us a little bit of insight as what kind of practice you run.
Okay, that's a long question because I've been in practice for 42 years now. 25 years ago, one of my sons, I have 6 sons, they were BMX champions back in those days, and one of them had an accident and got the handlebars of another one of the riders in his helmet, flipped him off the bike, and he was lying on the ground there, and I went over, and as a chiropractor, I checked out his neck, I adjusted his atlas, and he went back and finished racing. When we got home that night, he had a big bruise on the side of his head, and I thought, oh, well, that'll go away. The next day, he comes home from school and says, Dad, I can't read, I can't do math, and as an 8-year-old elite athlete that can't all of a sudden can't do things, he says to me, am I going to die? Because it was such a loss of ability for him. So I went to Dr. Carl Ferrari in New York and did his NOT course, and all I learned how to do was to adjust the sphenoid. And that was the bone that my son had out of place. It took me a week and a half to get him back to normal, and then we started doing other patients in the clinic that had similar learning disabilities and with equally good results. Then the parents would ask, can you do ADD? Can you do ADHD? And then eventually we did an autistic child and turned him around, and it's just progressed from there. After doing it for probably about 10 years, just my brother and I were the only 2 around here that were doing it. We had chiropractors asking us, okay, when are you going to teach us how to do that? So that's how the workshops started. So we've been teaching the workshops for about 15 years and adjusting and correcting the cranial bones for 25. I started off with the sphenoid, and then as you examine more and more of these special needs kids, you find that there's more than just the sphenoid out of place, and that the type of problems that they have are directly related to which bones are out of place and what part of the brain is affected.
So let's rewind a little bit, Roger. You said you've been doing this. You've been a chiropractor for 42 years.
That's correct.
And you're a graduate of
CMCC,
Canadian Memorial Chiropractic College. For those of you that don't know that acronym, so you've created quite a niche market for yourself, Roger. And I've heard stories that you've treated people that fly in from Europe to come and see you here in Canada. Is there any truth to that, Roger?
Oh, we have, especially in the summer, we have an international clientele. They come from all over the world. We've had many of them from Europe, from England, from Israel, from Australia, all over the place, and of course all through the States. And when we teach the chiropractors how to do this technique, we have over 1,300 CATS chiropractors now, and they send me their difficult cases, so they come from all over. So that's how you get an international practice, is having them come from all these different places.
And see, that's truly amazing, because that kind of confirms, what a great mentor of mine had said a long time ago, is that, we learn a lot of techniques, but what's going to make us really, really good is when we master a certain technique, we master a certain niche, and that's obviously something that you have done in the past 42 years.
Mm-hmm. Well, we've always been good at adjusting, but incorporating the cranial aspect, it's the brain that controls all the functions of the body. So it is the master computer, shall we say, of the functioning of the body. If you're just doing the spine, you're missing so much. And by adjusting the bones in the skull, you actually start to get better results with your spinal adjustments as well.
So
Did
Roger,
you notice that? Did you notice that this week?
I totally did. I totally did. Now let's expand on that a little bit, Roger, because we understand that a lot of listeners here might be doing strictly spinal adjustments, and again, no harm in doing that. So can you give me a quick synopsis, and which I learned over the weekend with you, as to why adjusting the cranial bones is so important and will allow you to get cases better that you couldn't have gotten better before?
Okay, what we started off with was showing you how to check the mastoid processes, and you can see that they are inferior on one side or posterior on one side, and what that will do is interfere with your ability to adjust the atlas. If you've got a lateral atlas on the left, and your right mastoid is low on the right by half an inch or three-quarters of an inch, when you do your left lateral atlas, you're just banging into the skull. It hurts the patients; they don't like it, and the atlas just bounces right back into place.
And I have to tell you, this split my head wide open. Typically, literally, because when you said that, we always say that our worst patients are actually our wives or our spouses because we've beaten them down quite a few times and they tense up. But I have to say that I checked my wife's mastoid and the occiput and did the work before, and which again, I'll warn the viewers, which literally takes 30, 20, 30 seconds. And I was able to have a profound adjustment on her atlas that I had never been able to do before because I was, like you said, banging into her mastoid on the opposite side.
Mm-hmm. Yeah, well, that's the first thing we show you guys, and that just enables you to get better adjustments using your cervical adjustments, getting the skull out of the way.
So in terms of the effects of cranial adjusting, I know you talked about the cerebral spinal fluid and the results happen between the brain and the cranial bones and the nerves. Can you extrapolate on that a little bit?
Well, when the skull gets knocked out of place, there's 22 bones in the skull. They are joined together by sutures. They do not fuse. If it's fused, it's pathological. So they have connective tissue, nerve supply, and blood supply in those sutures. Now, when you get a hit in the head, a kick in the head can be 1,000 pounds pressure. In order to move the skull bones like we do, takes 10 to 15 pounds. It's not a lot. So the bones in the skull can get knocked out of place. It's very, very common, especially when you start doing the kind of things we do. All the kids you hear with concussions and kids falling down the stairs, and even the birth process can knock the bones in the skull out of place. What that does is it decreases the space between the brain and the skull. This is the arachnoid space. This is where the blood supply, the oxygen, and the cerebral spinal fluid is that nourishes the brain. It gets the nutrients in, and then from the functioning of the brain, it gets the toxins out. If that space between the brain and the skull is compromised, same as a subluxation in the spine, it's going to cause malfunction in that part of the brain.
Well said. Now, how would you, because I know there's different cranial techniques out there, what makes your form of cranial adjusting that much more special and more prevalent maybe to the chiropractic profession?
Well, first off, it's fast. Um, I can do a full examination of the skull in like 20 seconds, and the adjustments take 5 or 6 seconds. When I teach it to you guys in the class, and I time you on your first full examination of the skull, and you guys were all 3.5 minutes doing it your first time. So that gets faster and faster and faster. And my question to you is, do you have right now 3.5 minutes to totally change somebody's life? So the examination is quick, and you get faster and faster at it because it's only palpation, and all chiropractors should be good at palpation. So we go from there. Then we teach you what is the normal, and we go over the different bones in the skull, show you how to determine what's out of place. And once you master the palpation, the adjustments are easy because you're just going in the opposite direction.
And
So
just to confirm,
it takes 5 or 6 seconds to do an adjustment. You don't have to hold contacts for long periods of time like some of the other techniques out there. And there's no instruments involved. You use your hands, and it's just a pressure. You use 10 to 15 pounds pressure to move the bones in the skull.
and one thing I will mention too, which was kind of different when I was learning about this, is that there's no testing, right? So you're just going by simply palpation
Right.
and your touch and what you're noticing in terms of your touch with your fingers.
Mm-hmm. And hopefully it's pretty uniform for most chiropractors. They can, when we are demonstrating it, I used to be concerned that I wouldn't get enough examples of things out of place with the students in the class. But now I know that the chiropractor, as you smile, and the chiropractors in the class usually bring everything we need. And there's one or two. At this time, we had two people with just about everything we needed to work on.
We had a room full of problems. So
And these are
let's
chiropractors that have been in practice for a long time, and
totally.
most of them are not holding their cervical adjustments.
Yep. So let's talk results, Roger. You're a pretty humble guy, and you shared a few tear jerking testimonials of people you've seen in your practice. One in particular that stuck with me is the amount of results you've had with autistic kids. Can you speak
Mhm.
about that, Roger?
Well, as I said, we started off with learning disabilities and then went to ADD and to ADHD. And then we had a patient ask if we could do autism. And I thought, well, I'd never done one, but I didn't tell them that. I thought, I'd love the opportunity to check and see if we can help. And sure enough, the frontal bone and the sphenoid were way, way out of whack, and the mastoid and the cervicals. And of course, they weren't holding their cervical adjustments. So that was 25 years ago. I've done probably about 4,500 autistic kids in that period of time now. And we are now at 66 nonverbal autistics that have spoken after their first few adjustments. Now, one of the problems we have with saying that is people come as new patients and they think they're going to take a new kid home in 1 week.
Right.
We then, on the other hand, we've done hundreds that can take a year. So it's not, you can't predict these things in the beginning. Our treatment programs, our protocol is always open ended because as much as experience as I've had, you don't know anything. You don't know how people are going to respond. But having 66 nonverbals speak right in front of you right off the bat, I mean, you just end up so stoked. And I tell you guys when I'm teaching you, when you have that happen, and we've had many, many of our students have that happen in their office, I said, you call me and we will celebrate together because that is awesome. It will totally change your concept of chiropractic, totally change your self confidence and your ability to help people. When you take these kids who are some of our cerebral palsy kids who can't walk or can't talk and they're just a puddle on the floor, and you come in and see them a month later and they're running around and talking, that is so motivational for you and for the patients because we have an open concept practice. So when this kind of thing happens in the office, everybody knows and everybody cheers.
See, to me, that is really the true meaning of chiropractic and changing people's lives and getting them to know really what chiropractic care is. Because, without going into details, there's a lot of things that we're doing as a profession that I think leaves the patients more confused as to what chiropractic really is. So, good for you, Roger, for doing all that. Also, what you said was results with things like concussions, headaches, migraines. Uh, any clinical gems? I know you shared with me, Roger, with an epileptic patient, what you always see, and with a migraine patient, what you always see in terms of skull. Any clinical gems that you can share with our group today?
Well, I mean,
Patterns of subluxations.
it's, it's very easy. It's always the sphenoid. A migraine headache is on one side of the sphenoid or the other, and the sphenoid goes in behind the eyes, so you can have migraines that go in behind the eyes and transfer to the other side. So one of the requirements to go to level 2 is you send in 5 case studies. So we now have all these studies from chiropractors that have taken the course stating the same thing, that migraines are always a misplaced sphenoid. Now, with regards to epilepsy, we have done many cases of epilepsy, and it is always flat left temporal bone.
See, that is amazing for everybody just to listen to that, and if that's not enough motivation to get you out there and take this course, I don't know what else is.
Well,
I
it's
can
just like the dermatomes in the spine. You know where those nerves go to. So
absolutely.
somebody tells you what kind of problem they have, you know what vertebrae are going to be involved. And conversely, if you check them without knowing their symptoms, you find what's out of place. You can tell them this is going to be your problem area. So it's the same thing with the skull. We call it cranial mapping in the skull, so we know what parts of the brain control what functions. And when people tell me in my consultation what kind of issues they have, I'm already knowing in my mind what part of the skull is going to be involved.
So, for the average viewer right now who's probably thinking, how do I incorporate this? Do I have time to do it? Again, we've talked about the time of the adjustment, which takes literally, not long at all. What are your care plans, Roger? I know you've touched on that a little bit. I know that you said they were open-ended. How many visits, the frequency? Can you talk about that with your average case?
Okay, frequency is very important. If you adjust somebody, whether it's the spine or the skull, and you don't see them for a week or longer, by the time you see them the next time, it's right back where it was, out of place again. So if you're only seeing a patient once a week, all you're doing is the same thing over and over again and never making any progress. How I started doing the multiple visits was with one of my boys. One of my boys was at a hockey tournament playing in the parking lot between games, got hit by a truck, and I was at another tournament with two of my other sons.
By the way,
So
Roger has 6 kids. All right.
I have six boys. So they were all elite athletes growing up, played AAA hockey and rep soccer, and they were Canadian BMX champions and did all the other things that normal kids do. Anyways, so he got hit by a truck, got thrown 20 feet in the air. So I wasn't there. So everybody got him to the hospital. They took X-rays. The medical doctor that examined him said that, his neck and his back were way out of place, and that he would never play hockey again. So my ex said to the radiologist, "I need to take those X-rays home." He said, "No, no, no, you can't do that." She said, "You don't want my husband here coming to get those X-rays because he's going to want to see them." So she brought them home, and I looked at him. His atlas was out of place a half an inch, T8 was out of place half an inch, and his sacrum was out of place a half an inch. So it's your kid. What do you do? It's called whatever it takes. I adjusted him at least 5 times a day, sometimes 6 and 7. From Monday till Friday, we re-x-rayed him on Friday morning. Everything was right back in place. He played hockey Friday night. So it's your kid. That's how I learned to do multiple visits. Then we started doing some satellite practices, and you're not going to tell people, okay, I want to see you Monday, Wednesday, and Friday when it's a 6-hour drive each way. So I started doing multiple visits on people that were far away, and we started getting far, far superior results with these people that we did multiple adjustments in a day. So that's 23, 24 years ago I started doing that. Now when we do a new patient, if it's a local patient, we give them the option. Whether I tell them I need to see them a minimum of 3 times in a week, and they can do that all in the morning or an afternoon. And if they wanted even better results, we could do more visits. These people, these international clientele that we have, they will come and stay in our hometown here at Barrie, and I will adjust them 5 times a day for 3 days in a row. So the easier ones we can get done in a week. The more difficult ones can take 2 weeks. So in 2 weeks, 3 days each week, we've done 30 adjustments. We can make major, major changes with people in that short of a period of time. Now, when we talk about doing multiple adjustments in the class, nobody's heard of that, and they say, "Do you charge for each adjustment?" Of course you do. I mean, you're changing people's lives. You're giving them 3 months worth of care in 6 days.
Right. And the second, third, fourth adjustment in the day is not worth any less than the first one you gave in the morning.
It's worth more because you're getting, as you go through the day, you'll get more correction, and you'll be able to remember exactly how they were when you adjusted them the first or second time during the day, and you realize you're getting more, and you're getting deeper, and you're getting more correction, and they start to hold it even better.
So I came back home, Roger, totally inspired by by what you had said and what we had practiced and done and learned, and so I started my 5 cases, which I need to take in order to get my certificate and be able
Already.
to do the level 2.
That's good.
So I took 2 years and did the chiropractic neurology diplomate. So I've attracted a lot of concussion cases. So I had this young kid who has now suffered his 3rd concussion. So he was referred to me by another chiropractor. So I had been treating him for a month and was plateauing in terms of his dizziness. A lot of other things have gone away, but his dizziness was still there. So unsteady on his legs, and he kind of mentioned that he felt like he was on an elevator all the time. So I told the mom, I told him, he's 12 years old. So I said, look, I went to a conference. We're going to work on your skull. We're going to examine your skull and see if there's a chance. And I explained the whole thing about cerebrospinal fluid. So I gave him an adjustment. Sphenoid was a major issue, as well as the occiput and the mastoid that had shifted. So I said, just go home. I gave him a warning, like you said, you might feel a little change. And they arrived the next morning, and the kid was literally, and I haven't seen kids are not necessarily emotional all the time, so they won't cry because they get good results, but he was almost in tears saying it's the first time that he has a steady head. And that was after one adjustment to the sphenoid and occiput. So I was totally blown away because of my knowledge with neurology and the diplomate program that I took, how one adjustment to the cranials could have such a profound effect on a concussion case.
So that'll just be another Tuesday for you now.
No,
Things will happen all the
blown
time.
away. I was blown away.
Yeah. Okay. And
So
remember what I told you when you get to your patients, when you get back, you're going to find that these misalignments in the skull are much more noticeable than what you're finding on the chiropractors in the class.
yes,
Did you find that?
yes, totally. Yeah.
Yeah.
And what was is it sphenoid? Is it out to the right? You're not sure. In a classroom on a patient is like for sure. Like it's so obvious. It just sticks out like a sore thumb.
Yes.
So Roger, hopefully we've inspired a bunch of people listening here. And I've always said to my list that I will never promote something that I haven't done, that I don't fully endorse and tried. And this is definitely something that I can say that has totally inspired me for the weekend, and I think is going to keep me inspired for the rest of my career. And we all get into this little lull in practice sometimes where you take everything for granted, and you're kind of going through the day not really appreciative of what you're doing. And sometimes we need a little kick in the butt and something that inspires us and gets us to that next level and forces us to take the bull by the horn and do what we were meant to do, which is chiropractic and save lives. For the person right now that wants to get a hold of you, Roger, can you give us a little bit of your contact information and how they can do that? We're definitely going to leave a link on the bottom with the email, but how can we get a hold of you?
Okay, well, hitchhiking on what you just said there is our technique is the chiropractic principles applied to the skull. And then you start getting the kind of results that you're getting there. And I mean, that there is nothing more inspiring for you than getting these kind of results. And it is absolutely the best referral tool you can have. Patients talking about, I went to see my chiropractor, I went to see Clayton, and in one adjustment, he took away all my concussion symptoms. So you start spreading words like that, and then you get one with an autistic child that can't speak. Imagine how that goes through a family. And that's one of the ways we get these international clientele. We adjust someone from relatively close to our hometown here, and all their relatives are in Europe. So it spreads like crazy. So on my website, which is I have two websites, one for the chiropractors, one for the patients. On the patient website, which is turnerwellness.com, you can download my ebook on concussion, which explains the mechanism, which is very different than the conventional understanding of how concussions affect the brain. And when you check all of the information on the internet and read all the books about concussion, nobody has a protocol to correct it. If you don't correct the positioning of the bones in the skull, you don't fix concussion. So then the other website for the chiropractors is catsworkshop.com. Has the seminar schedule on there. You can buy the seminars as a DVD package and do them at home. As we had a couple this weekend who'd done the DVDs at home first and then came to the actual workshop. Basically, the difference is you get to touch. On the videos, you don't get to touch, but I'm assuming that most chiropractors are very good at adjusting and palpating, so you can learn it just from the DVDs.
Perfect. Now, if people want to attend your seminar, Roger, like I did, level 1, I realize there's 3 levels. I think level 3 is just through a book, right? Or several books?
We did level 3 for a few years, and that's where I put the cosmetic adjusting. What I've done is rearranged my schedule a little bit so that the cosmetic adjusting of how to adjust all the different bones in the face, the nose and the zygomatic and the TMJ and the maxilla and all inside the mouth, we show you how to do that. We show you how to actually adjust the eyes. Eustachian tubes, tonsils, all those things are done in level 2. So that is now in level 2 the class. But if you order the DVDs, they were done a few years ago. So it's in 3 sections. Level 1 is how to do all the sutures. 2 is we actually teach how to get rid of the indents and protrusions on the hard parts of the bone.
Okay.
Now, for a few people, that's a bit of a stretch, but you saw me do that, didn't you?
Yeah,
You saw
totally
me
did.
change those things.
2 lid and palpatory changes right away.
Yeah, and the patient's going to feel immensely different because all of a sudden they've got blood and oxygen where they didn't have it before.
Okay. So somebody goes on your website, Roger, and they say, you know what, I want the hands-on. I'm going to order DVDs maybe, but I want to get the hands-on. I want to do level one. Let's talk pricing and what you're able to do for our list here.
Okay, level one is $8.99. Our next workshop coming up is in LA. I'm looking up at my calendar here to get the right date. May 14th and 15th in LA is
Okay.
our next level one. Um, the next one after that is not till the. Nobody wants to go to seminars in the summertime, so we don't have any more until September.
Okay.
So it's all on my website, the schedule. We are planning on possibly doing one in Florida as well.
Okay.
Um, we always do a hotspot workshop. We go to a vacation place down south. Last year we did Costa Rica, and it was so nice. We're going back again this year. So
Beautiful.
that's always in November, and we're doing level one in November. The neat thing about level one in the hotspots is we do the usual 2 days to do the course, and then we get together every day at 5 o'clock, and either I adjust everybody or you work on each other. So you're getting the chiropractors are going to get to see what it's like to have intensive care, like just even if it's just once a day for 5 or 6 days. It makes such a huge difference and converts you to start doing multiple visits in your office.
Totally. So the price for your level one original, like the regular price is what, Roger?
$8.99.
8.99. If it's in the U.S., it's 8.99 U.S. If it's in Canada, it's 8.99 Canadian.
That's correct.
Okay. And what you're able to do for our list is what?
We talked about that. We're give them. We've done Parker for many years in a row. Haven't done it the last couple of years, but we used to give them a special price. It was always in Vegas, so the price was $777.
Okay.
So we will offer that to your listeners too.
Awesome. So just to review, people need to go on your patient website and download the Concussion book, which is a free
Yes.
ebook, and then go on your CATS workshop, which is a site for the chiropractors where they can actually see the schedule for the seminars. And actually, so for the listeners, just mention Adjusting Attitudes blog, and you'll be able to get that discount for the level
Yeah.
one pricing.
Okay, that's not hooked up on my website yet.
Okay.
They will have to phone me in order to get the discount.
Okay. And I'll put your phone in the email.
Okay.
But if you want to just share the phone number right now, Roger, go ahead.
Okay, my home office is where we are on Mondays and Fridays. Is 705 792 1315.
Perfect. Roger, last thing. I'll leave you with a little. I didn't tell you about this question. You've been in chiropractic for a long time. What would you tell our listeners, and where do you think chiropractic care is and where it's going?
My son just graduated from CMCC 2 years ago, and he said to me, Dad, half of the kids here shouldn't be here. They can't adjust. They do not understand chiropractic anywhere near to the level of what you do. And he said, I didn't even invite you to come to speak to the class because they're not ready for you. Here at my age, at 70, I'm leading edge, and way, way ahead of leading edge with what we do. So the chiropractors that are good at adjusting will adjust, and they will continue to get better if they practice and focus on that. Every day when I get up in the morning, I ask myself, okay, whose life am I totally going to change today? And how can I get better at what I do? I'm always improving my technique. And it's one of the reasons why we're considered one of the best adjusters in the world is because I'm always getting better at it. Because I focus on that. Even every day, and my wife will be talking to, she runs the office, and she'll talk to me when I'm working on somebody, and then she'll stop and realize he's not going to hear me because he's so focused on what he's doing and imaging what he's doing. And even after 42 years of being in practice, it does get to be routine. But working on the skull and getting the kind of results that you just experienced already this week, I mean, that happens all the time in our office. But we still get stoked and we still get emotional when we have one of these kids, these nonverbal autistic kids that speak. Last week we had an autistic child who walked on his toes and would catch his toes and stuttered and stumbled all over the place. Yesterday we had him walk down in front of a full reception room with not catching his toes with his feet straight, and he turned around and sang to everybody. I mean, that's the
Wow.
kind of thing that you can experience in your office by changing the position of the bones in the skull.
Roger, I want to thank you so much for your time today. Not only today, but the time that you take away from your family and doing seminars, and loving our profession enough to help chiropractors grow to the next level. I think that's something that's amazing, and you have a gift, obviously, that has served you very well, and not being selfish to the point where you want to hold that to yourself and you want to share it with everybody else. I want to truly thank you as a chiropractic brother, and helping the profession, as a whole, grow to the next level.
Well, thank you very much. It motivates us too, and I tell people, okay, my retirement plan is early retirement at 85.
That's right. Just as a
I
heads
still I
up.
still want to have time to play with my toys and ride my bike and do all those things, you know.
No, absolutely. And just as a heads up, as one of the upcoming interviews, we're going to interview a guy by the name of Dr. Keith Pine, who I introduced you to, Roger, who is the first chiropractor to be the head of a medical professional sports team. So he's the head of the Washington Nationals baseball team, where the orthopedic surgeons answer to him. So he's the head of the medical team. We're going to interview him. And we had a very great discussion, you and I, Roger, with Keith, and how he wholeheartedly confirms that in all concussion cases there's definitely a missing link in terms of what we can do, and how cranial adjusting is going to fill that gap. And I think you guys are going to touch base with one another, because Keith also has some issues that he'd like to fix. So just a little heads up, guys, we're going to have an interview with Dr. Keith Pine that'll totally blow your mind away as well.
When he talked to me the other day and told me what his problem was, I told him what side of the head he was hit on.
That blew me away, Ted or Roger. He was we hung up, you and I stayed on the phone with Keith. He says it's kind of amazing he knew what side of the head I had been hit on. So I think just that alone, was pretty eye awakening in terms of your knowledge and your success in the past. So thank you so much for taking that call, and we'll be able to interview him a little later on. So again, Roger, thank you so much. Again, this is Dr. Clayton Roach telling you to be well, practice hard, and go serve your community to the highest level. Take care. Bye-bye.